Hello, my name is Natalie Thurmond. I'm an Auburn University School of Nursing graduate student, and I am here to talk about COVID-19, its effects on the prison system and incarcerated individuals. The intention of this project is to call on legislators to end mass incarceration in the era of COVID-19 as a way to decrease spread of this highly contagious disease and explore alternatives to incarceration for non-violent crimes. The United States leads the world in number of incarcerated individuals, with 2 million citizens incarcerated at this time. The majority of these individuals have pre-existing conditions, low health literacy, and are members of minority populations such as African Americans and Latinos. In April, the spotlight was placed on prisons for being a hotbed for COVID-19 when 73% of an Ohio prison inmates tested positive for the disease. Overcrowding inhibits inmates from social distancing themselves and leads to an increase in communicability of this disease. Furthermore, prisons traditionally lack cleaning supplies or hygienic supplies, making not only COVID-19 contractable, but also lice, HIV, and staph infections. Prison inmates are an extremely vulnerable population to COVID-19. Ethically, no members of society know the mental health implications of social isolation better than inmates. Throughout mandatory stay-at-home orders, many members of the community have expressed feelings of anxiety, depression, and hopelessness from decreased human interaction. Much like prisoners, many members of the community have expressed depression and anger with lack of free will this pandemic has cost them. Fortunately, members of the community have access to mental health counseling, whereas inmates do not. And it is a well-documented fact that untreated mental illness runs rampant among incarcerated individuals. One possible positive impact from this pandemic is a more empathetic view on the plight of incarcerated individuals. Ending mass incarceration can have a positive impact on advanced practice nurses who serve this population, as less inmates means more time spent with an individual. Thus, diagnoses are explained thoroughly and improvements to lifestyle can be made. For example, diet and exercise changes in patients with diabetes. Also, mental health diagnoses will not be left untreated. Policy changes to the prison system in response to COVID-19 include admitting inmates back into the community to access resources, home confinement, and replacing arrests with citations. The effect on crime is a legitimate worry with mass decarceration. However, in 2011, California prisons released 30,000 inmates into the public to serve the remainder of their sentence in home confinement. During this time, there was no increase in crimes among the state. Releasing inmates accused of nonviolent crimes into the community allows them access to resources that are just unavailable in prisons. Government-provided services by inmates such as trash pickup or serving at the local humane society can serve as a low-cost tool to improve communities. It also allows the offender the opportunity to begin a job search to re-enter the community as a productive member of society. Home confinement serves the same purpose of prison in that liberties are restricted, however, it is done with more space, therefore abiding by the CDC's recommendation of social distancing. Lastly, fines for nonviolent crimes can keep prisons and jail populations low and increase revenue for counties and states. Overcrowded prisons has been a policy issue in the United States for many, many years. There is no better time to push for mass decarceration than in the midst of a global pandemic. Thank you so much.